To examine the cranial nerves, begin with cranial nerve 1, the olfactory nerve, which mediates the sense of smell.
Did you pinch off one
To assess
nostril
its
and
function,
breathe
first be sure both nasal passages are patent.
in? Any problems?
No.
Then, with one of the
I'd like you to
patient's
close your
nostrils
eyes
occluded
I'm gonna
and his
answer
eyes
then of what it
closed,
smells.
pass a mildly aromatic and familiar
Control one
substance,
nostril.
such as vanilla, cloves,
And
soap,
breathe in.
or coffee, under the open nostril.
Alcohol?
If the patient detects the smell,
The other
ask him to identify it.
Breathe in.
Repeat this test on the other side.
Cinnamon.
Cranial nerve 2, the optic nerve, mediates vision.
I'd like to test your vision now. If you could hold
To
that
assess
in
its
your right
function, check the patient's visual acuity and visual fields and inspect the optic fundi.
hand. Can you read the numbers on that
If a
line?
Snellen chart is not available, test
9,
visual acuity
3,
by using a special handheld
7,
eye card. To
8,
do this, ask the patient to cover one eye, hold the card about 14 inches away from his eyes, and read aloud the smallest print possible.
4,
If the patient requires reading or general-purpose glasses or contact lenses, he should wear them.
Can you cover up the other
Then
eye?
test the other eye.
Thank you.
For screening purposes, visual fields are tested
Now,
by
I'm gonna test your
confrontation.
peripheral vision.
Face the
What I'm
patient
gonna do is
directly
bring my
and
weight
imagine a
down
glass
from the
bowl
outside
encircling the head.
towards the center.
Ask the patient to look with both eyes into your eyes.
Point when you see
Then place your hands about 2 feet apart, lateral to the patient's ears. Then slowly move the wiggling fingers of both hands along the imaginary bowl until the patient identifies them. Repeat this action in the upper and lower temporal quadrants. Normally, a person sees both sets of fingers at the same time.
I'd like you to cover up your left eye.
If you think you've found a visual field
I'd like you to
defect,
say now,
such as
when you
loss
see
of
the
vision in the right temporal field, slowly move your wiggling fingers from the defective area of the field toward the better vision. Repeat this at several levels until you can define the border of the defect. These responses suggest a defect throughout the temporal half of the
Cover up
field.
The other eye.
Test the other eye for an accompanying defect.
Look straight ahead at me.
Next, inspect each ocular fundus by using an ophthalmoscope. Assess the optic nerve by inspecting the optic disc. Note its color, the sharpness of the margins, and the width of the physiologic cup.